Matthew Holt, on location for Health Innovation TV. I'm also with the Healthcare blog and Health 2.0. And funnily enough, with me is my colleague at Health 2.0, JL Neptune, who is the Senior Vice President and runs our health innovation business out of New York City. JL, thanks for coming and being dragged out of you. Tell us the first thing you're doing at Health Datalooza. You're running a Codapalooza around the corner. What's going on there?
Well, we're doing a lot of things. The Codapalooza is one of the things that we're doing. So we're working with the organizers of the Health Datapalooza on a coding event that started on Friday. Well, where are we? We are Tuesday. So it actually started Sunday night and is ending today, Tuesday. We have team demos in a short while. We'll be demoing 10 different teams that have been given access to CMS claims data. And they're going to be using that data and hacking that data and hacking tools to make it easier for providers to manage populations, take care of chronic conditions. And we'll be presenting the winner at 4:30.
Great, and then of course that's part of an ongoing effort that we've been working with ONC and CMS and other government agencies and many other organizations around challenges. How many challenges has Health 2.0 done now?
We are over 50. I think we're in the 55 range now in the ONC program that you're referring to, the Office of the National Coordinator. We've done about 24. I think in total we'll have done 25 in 2 years, and then the rest are all private sector projects.
We're giving away $4 million?
We have given away or allocated to give away $4.5 million.
I can't understand why I don't keep more of it, but there we go. I guess that's not the rules, right? All right. Let's talk a bit about some of the challenges that we just launched. You're involved in 4 launches this week, is that right?
Well, 2 closes. Actually 4 closes and 2 launches. So the 2 launches are the RWJF Price Transparency Challenge, Hospital Price Transparency Challenge that was announced yesterday. And then we also had the Blue Button Plus Co-Design Challenge that launched yesterday as well. And then in terms of projects that were closing, we had the PCORI Challenge, the Patient Researcher Matching Challenge that closed, My Air, My Health, CrowdScare for Cancer, and Apps for Tots.
Good job remembering all that.
It's a very busy week.
I'm sure JL's been awake a lot and doing a bunch of other things as well. So if you were to step back and helicopter up, since you started working at Health 2.0 a little over 2 years ago, maybe 2 years ago. Is it 2 years ago this month? Something like that.
Day 1, right? So more than 2 years ago.
Right. What is your feeling? Compared to how you thought the challenge landscape was going to play out? Other players coming into the market of offering challenges and other large organizations outside of the government taking it up. Where do you think we are and where do you think we're going in that market?
I think we're still very early in the history of running challenges. Remember, the America Competes Act, I think, goes back to, 2009? So many of the people in the government who could be using challenges are just starting to wake up to the reality of what they can do. There's a lot of education involved to help people understand, challenges and the capabilities of various challenge programs. So I think we're very early, certainly on the government side, and I think that a lot of what's done in the government is reflected in the private sector. So we're seeing uptake on the private sector side as well.
So talk about that private sector side. We've seen some big challenges, not only coming through Health 2.0, but also through Illuminati Labs and the folks in the room here, Kickstarter and Health Tech Hatchet getting involved in partnerships as well. We just heard about Kaggle, from who are also running that. So there's a little ecosystem there of companies now starting to support this, which is always good to see, to help that kind of thing and help push over the market as a whole. If you were to sort of judge when you go and talk to a potential challenge sponsor like a big drug company or a big plan, I mean, how new and how are they going, what is this stuff, and how much are they getting closer to going, oh, I understand that, and this is something that we can now figure out as a regular way to sort of help spark innovation and help our business? Where are we in that, scale of 1 to 10?
Scale of 1 to 10, I'd say it's bimodal, and I'd say that there is one group that's sort of, the 7-8 range, and then there's another group that's sort of the 2 to 3 range. I think the 7 to 8ers have educated themselves about challenges, have a specific problem that they're trying to solve, and view challenges as an opportunity to really craft a solution to a specific problem. I think the 2s and the 3s are people who have more, they've heard of challenges, they have an idea of how they maybe could use a challenge, but need a lot of education to get to that 7 or 8 range.
Right. And then on the folks who are, I think, in the 7 or 8 range, at least now, I just wanted to highlight one challenge we've done, which is the one with Allscripts. And to me, that's one in which Allscripts, which had been a unfair to say, relatively siloed enterprise software vendor, that decided that it was going to instead open up its API and open up a marketplace and redevelop kind of marketplace. Talk a bit about how that's gone with them and how you see that fitting into their overall strategy.
Sure. Well, I think the Allscripts challenge has been a runaway success, and that's the feedback we've gotten from multiple people at Allscripts. The CEO has talked about the challenge and the importance of the challenge to not only the specific business that is running the challenge, but really to the whole company. We had for the phase 1 of the challenge almost 100 submissions, 100 teams, 97 teams entered, which was way beyond their expectations, and they got a lot of really high quality entries from that. And then for the phase 2, I think they have 45 teams that are going into phase 2. And really what they're trying to do is create almost an Apple App Store model, right? Where essentially they create a platform, they lower the barriers to make it very easy for developers to build apps onto their ecosystem and to sell into it. And this is really just the beginning of that for Allscripts. And it's potentially transformative and an interesting way for them to compete against the Epics and the other big players. So.
Right. Well, that's how we're doing Health 2.0. Health 2.0 is doing challenges. I'm Matthew Holt, happen to be the co-chairman of Health 2.0. So this is an inside job here. We're talking with my colleague, Jean-Luc Neptune. As you can tell from the interview, I know very little about our challenge business because it's
the question.
It's in such good hands.
You know the answer to the question.
I very know the question. Don't know any of the answers. Talking with Jean-Luc Neptune. JL, thanks for your time today.
Thank you, man.